Welcome back to the Deep Dive. We are doing something a little different today. We're stepping into the time machine, or I guess we're just looking at the calendar on the wall. It is Monday, February 9, 2026.
A very specific date. And honestly, a pretty tense one if you work anywhere near healthcare finance.
Extremely tense. I mean, right now, the entire sector is basically holding its breath. Tomorrow morning, February 10th, before the bell rings, Oscar Health ticker OSCR is dropping its Q4 earnings report.
And this one feels different. Looking at the stack of research we have on the desk, you've got analyst notes, credit card transaction data, even the new administration's policy papers.
The stakes, well, they just couldn't be higher.
It really feels like a binary moment, doesn't it?
It absolutely is.
Yeah.
I mean, we are either looking at a company that's about to spiral because of all these regulatory headwinds, or we are looking at one of the most aggressive, most contrarian turnaround stories in modern insurance history. There's really not much in between. That's the mission today. We're calling this special edition Griffonomics. We need to parse the signal from the noise before that opening bell tomorrow. And the central metaphor we have to start with, it comes straight from the top. Mark Bertolini, Oscar's CEO, he's been calling his company a pirate ship for a while now.
Which is a great image, right? It implies agility, maybe a little bit of danger.
A little bit of swagger.
A little bit of swagger, but definitely a huge departure from the norm.
Exactly. He frames Oscar as this agile pirate ship trying to outmaneuver the, quote, Spanish galleons. And the Galleons, of course, are those massive lumbering legacy insurers like UnitedHealth and CVS.
Right. But the context here is just so critical. I mean, right now, the seas are incredibly stormy. We're in the middle of what the whole market is calling the Subsidy hurricane.
That is the term of the year, the expiration of the enhanced ACA tax credits at the end of 2025. This was the cliff everyone saw coming for years. I mean, this was supposed to be the event that finally capsized the pirate ship.
Supposed to be. But our deep dive today, it suggests the pirates might have found a different map. A map that, frankly, the rest of the market has largely ignored.
And that map includes a massive 28% price hike, a secret weapon they're calling Oswell, and this weirdly perfect alignment with the Trump administration's new healthcare vision.
It is a fascinating thesis. The market has priced in an absolute disaster. But when you look at the granular, hard data, it really suggests Oscar has executed a massive pivot.
So is this a death spiral, or is this the beginning of Oscar's true profitability year? Let's unpack this. To really understand the danger, though, we have to start with the ship itself. Why is Oscar so vulnerable compared to, say, a UnitedHealth? Why do we call them a pure play?
This is the fundamental disconnect for so many generalist investors. When we say pure play, what we mean is that Oscar is almost entirely an insurance company that's focused on the ACA, the Affordable Care Act, and, Obamacare marketplaces.
So that's their whole world.
It's their oxygen. They live and die by the individual exchange.
Whereas a company like UnitedHealth,
Oh, UnitedHealth is a whole different beast. It's a conglomerate disguised as an insurer. Yes, they have UnitedHealthcare, the insurance arm, but they also own Optum. And Optum owns the physician groups, the surgery centers, the data analytics, and critically, the pharmacy benefit manager, the PBM.
right, they're vertically integrated. They make money when you buy the plan. They make money when you get sick, and they make money when you go pick up your prescription.
They own the casino, the slot machines, and the ATM in the lobby.
That's a perfect way to put it.
And Oscar doesn't. They don't own hospitals. They don't own huge physician groups. They are a technology layer that sits on top of the healthcare system. They operate in 18 states with about 2.1 million members as of late 2025. That gives them roughly 8% market share.
So they're a real player, but
But because they don't have those other revenue streams, those Optum-style cash cows, they are existentially dependent on the individual exchange market.
so if the ACA market sneezes, Oscar gets pneumonia.
Yes, and UnitedHealth just shift money from the left pocket to the right pocket and keep moving.
Okay, so that's the structural vulnerability.
Precisely. But that is also where the pirate ship metaphor tries to flip the script.
Yeah.
Because they don't own all that heavy infrastructure, the bricks, the mortar, the thousands of doctors on payroll. They can, in theory, maneuver faster. They pitch themselves as tech native.
I want to push on that tech native label because, I mean, let's be honest, every company in 2026 claims to be an AI company. Is this just marketing fluff, or is there actual leverage here?
It is a fair skepticism to have. A very fair skepticism, but I think we see the proof in Oswell. Oswell is their AI personal health agent, and it launched fully in late 2025. And we have to be really clear, this is not the standard chatbot that just tells you your deductible.
It's not just a glorified FAQ page.
No, not at all. Oswell is integrated right into the clinical workflow. It pulls directly from your medical records, from your interactions with care guides, your plan benefits. It handles prescriptions, test results, symptom checking. But the business goal is what really matters here. For a company that doesn't own the doctors, the only way to control your costs is to control administrative bloat and manage utilization.
And utilization just means keeping people out of the emergency room when they don't really need to be there?
Exactly that. Or making sure a diabetic member gets their generic prescription refilled before they end up in a coma. In a vertical system like United, you can control that by just owning the doctor and telling them what to do. Oscar has to control it by influencing the patient.
And Oswald's the tool for that.
It's designed to do that automatically at scale. It's about leveraging code to do the work of a huge, vertically integrated system, but without the massive capital expenditure of actually owning the buildings.
So they're betting on software over hardware? But there's another piece of the puzzle here, right? A sort of escape hatch they've been building called ICHRA. ICHRA. Even in 2026, that acronym is still a mouthful.
Oh, it's an actuary's dream and a marketer's nightmare. Individual coverage health reimbursement arrangement.
Yeah, let's step to the analogy from our notes. This is the 401k of healthcare.
That is the best mental model. It's perfect. Think about retirement. You know, in the old days, you had a pension, the company managed it for you, you got what you got. Then came the 401k. The company gives you the cash, and you decide where to invest it. ICHRA is exactly that for health insurance.
So instead of the company buying a big group plan,
Right. Instead of a small business buying a group plan for everyone, which is expensive, it's an administrative hellscape, and it's one size fits all. The employer just gives the employee a set amount of tax-free cash each month.
and says, go to the marketplace and buy the plan that actually fits you.
Here is $500 a month. Go shopping. And this is where Oscar's model really shines, because Oscar is built for the individual consumer. They have the app, the brand, the user experience.
Right, United Health's legacy systems are built for HR managers. They are not designed for Bob from accounting shopping on his iPhone.
You've got it. They're clunky.
So is this actually moving the needle, though? Or is this just a niche experiment that sounds good on paper?
No, the growth is absolutely real. We saw small employer adoption of ICHRAs grow 52% in 2025 alone. This is Oscar's hedge. It's their escape hatch. If the government subsidies dry up, they have this growing pool of corporate-funded members who are shopping with their boss's money, not just government handouts.
Okay, so that's the ship. It's agile, it's tech-heavy, and it's pivoting toward these corporate dollars via ICHRA. But now we have to talk about the storm, the subsidy hurricane. Let's go back to late 2025. Why was the mood so grim?
Grim is putting it lightly. We were facing a strategic inflection point. The enhanced ACA tax credits, the extra subsidies that were introduced during COVID and then extended by Biden, they were all set to expire on December 31st, 2025.
And the cliff meant that for a lot of people, their premiums were going to effectively double overnight.
Double or even worse in some cases. And the market fear, the narrative that drove Oscar stock down to these really distressed levels was the death spiral.
Okay, walk us through the mechanics of a death spiral. It sounds like a bad heavy metal band, but economically, it is just terrifying for an insurer.
It is the absolute nightmare scenario for insurance. Insurance relies on a balanced risk pool, right? You need healthy people paying premiums to cover the costs of the sick people. The fear was that when prices doubled because the subsidies expired, the healthy people, the 28-year-olds who feel invincible, would just quit. They'd drop their coverage because it got too expensive.
I'm 28, I feel fine. I'm not paying $600 a month for this.
That's the exact thought process. But the sick people, the people with cancer, with diabetes, with chronic heart conditions, they stay. They have to stay no matter what the price is.
So you lose the revenue from the healthy people, but you keep 100% of the high costs from the sick people.
That's it. That is adverse selection, and it just destroys your margins. Analysts were predicting a 20 to 30% collapse in enrollment, leaving Oscar with a completely toxic risk pool.
So facing this hurricane, Oscar had a choice. They could have tried to keep their prices low, eat the cost, just to beg people to stay, but they didn't do that. They did something that seemed kind of suicidal to some observers.
They did the unthinkable. For the 2026 plan year, Oscar raised their premiums by a weighted average of about 28%.
28%. That is a massive hike. You're asking customers to pay significantly more right at the exact moment they are losing all their government help.
It is an aggressive, completely counterintuitive move, but this is the core of Griffonomics. That's the philosophy of their CFO, Sid Sankaran, and the rest of the leadership team. They looked at the data and they said, we cannot afford to underprice this risk anymore. They decided they would rather have fewer customers who actually pay enough to cover their medical bills than a massive number of customers who are just bleeding them dry.
They chose margin over volume, plain and simple.
They priced ahead of medical inflation. They're making a huge bet that their user experience, the app, Oswell, the brand loyalty, is sticky enough that people will grumble, but ultimately they will pay the higher price.
Which brings us to tomorrow morning, Section 3, the financial realities. When that report drops, every single trader on Wall Street is going to be Controlled F, searching for one specific acronym.
MLR, the medical loss ratio.
Let's define it clearly for the listeners who might not be actuaries.
Yeah, simply put, it is the percentage of every premium dollar that the insurance company spends on actual medical care. If you pay me $100 in premiums, and I turn around and pay your doctors and hospitals $85, my MLR is 85%.
And the remaining $15 is what you have left to pay your staff, run your servers, and hopefully, book a profit.
Exactly. So lower is better for the insurer.
And what's a good number? Where do you want to be?
Generally, yeah, you want to keep it in the low 80s. That's a healthy range. But here's the problem Oscar was facing. In Q3 of 2025, their MLR spiked to 88.5%.
So they were spending nearly 90 cents of every dollar on claims. That leaves almost nothing for the lights and the salaries. That is razor thin.
It is dangerously thin. However, and this is absolutely critical context for tomorrow, you have to look at the neighborhood. You have to look at the Spanish Galleons and their other peers. Take a look at Molina Healthcare. Their marketplace MLR has been spiking toward 99%.
99%. So they're basically just swapping dollars, taking in a dollar, handing out a dollar, and then losing money on the admin.
They're completely underwater. So when you see Oscar at 88.5% versus some of their competitors at 99%, it tells you something really important. It goes back to our earlier point about technology. It suggests that maybe Oscar's tech stack, maybe that utilization management through Oswell, is actually catching things that the legacy systems are missing.
They're the cleanest shirt in a very dirty laundry pile.
In a way, yes. And that explains the 28% price hike. That's the fix. If Oscar can collect 28% more money per person, even if medical costs stay high, that ratio mathematically must drop back down into a profitable zone, unless...
Must all the healthy people left.
Right. If the healthy people fled, then the medical costs per remaining person would just skyrocket, and that would cancel out the entire price hike. That is the gamble.
But it seems like the smart money is maybe sniffing out a win here. We found a fascinating data point in the earnings preview notes about analyst revisions.
This is a classic tell on Wall Street. In the last 3 months, heading into this supposedly scary report, there have been 7 upward revisions for Oscar's revenue estimates.
And how many downward?
0.
Wow. Okay, that is a signal. The media headlines are all screaming death spiral, but the analysts who are actually crunching the numbers are quietly whispering, they're gonna beat.
To think Oscar might surprise us. And that brings us to Section 4, the data versus the narrative. Because we have some hard numbers here that completely contradict the doom and gloom story.
Okay, let's start with enrollment. Remember, the prediction was a 20 to 30% crash because the subsidies expired.
Total disaster was the baseline expectation, a bloodbath. But the actual data from CMS, the Centers for Medicare and Medicaid Services, it dropped pretty recently. And it shows that enrollment across the entire market declined by only about 4.94%.
Wait. Say that again. Less than 5%.
Less than 5%. Now, that represents about 1 million members leaving the entire market. Sure, that's not nothing. But compared to the predicted catastrophe, that is a massive beat.
So the market is far more resilient than expected. The product is sticky. Even with prices doubling for some, people said, I still need insurance.
Or they just found ways to make it work. It turns out healthcare isn't like a streaming service. You don't just cancel your health insurance like you cancel Netflix. The demand is resilient. People prioritize staying insured, and they likely cut their spending somewhere else.
Okay, so volume held up way better than expected. But what about the revenue? What about the money coming in? We have some alternative data here that is, well, Frankly, it's shocking.
We do. We have access to some third-party data that tracks credit card transactions for December 2025 and January 2026. This is tracking what people are actually spending on their premiums.
And what does the plastic say?
It shows a year-over-year surge of plus 35% in transaction volume for Oscar Health.
35% growth. How is that even possible if enrollment was down slightly?
Well, just think about the math. Enrollment dropped slightly, let's call it 5%, but prices went up 28%. So if you retain 95% of your customers and you charge them 28% more,
You make a lot more money.
you make significantly more revenue. That plus 35% credit card signal implies that Q1 2026 revenue, which you're going to give guidance on tomorrow, could be vastly higher than what the consensus estimates are currently expecting.
That is the hidden signal, a really big one. But there's one more. It's time for some Sherlock Holmes work, the hiring data.
This is one of my favorite alternative indicators. In early 2026, right when they are supposed to be facing this existential crisis, Oscar doubled its job postings. They went from 127 open roles to 259.
Okay, companies that are bracing for a collapse do not double their hiring. They freeze hiring. They do layoffs.
Exactly. Expanding your headcount by 100%, it signals confidence. It signals expansion. It suggests that management is seeing something on their internal dashboards that the public isn't seeing yet. They are gearing up for something.
And that something might just be the new political reality. We have to talk about the elephant in the room, or I guess the administration in the room. Section 5, the regulatory environment and the Trump factor.
This is the real wild card. The political landscape is incredibly confusing right now. You have Trump threatening to veto any subsidy extensions, which on the surface sounds terrible for Oscar.
Right. The simplistic take is Trump hates Obamacare. Oscar is an Obamacare company, therefore sell Oscar.
That is level 1 thinking, but we need to go to level 2. You have to look at the great healthcare plan that the administration unveiled on January 15, 2026. What is the core philosophy in that plan?
The core philosophy seems to be the shopper. Trump wants to move away from paying the insurance companies directly. He wants to give that subsidy cash directly to the individual.
Exactly. Here's your voucher, here's your health savings account, you're now a consumer, go shop. Now you have to ask yourself, in a retail shopping war, who wins?
The company with the best store, the best interface, the easiest checkout.
The company with the best user interface, the best app, the smoothest sign-up flow? Oscar is the Apple of this space. Their app is consistently in the top 10 health apps on the App Store.
And the Spanish Galleons.
Their interfaces are, oh, let's be polite and call them legacy. They are clunky. They're confusing. They were built for HR departments, not for individual shoppers. If Trump turns patients into shoppers with cash in hand, Oscar's conversion rate is going to absolutely crush the competition.
That is fascinating. So the policy that looks like a threat ending the direct payments to insurers is actually a massive tailwind for Oscar's specific business model.
Yeah.
Because they're just better at retail.
And there's another layer to this. The Great Healthcare Plan explicitly attacks middlemen. It attacks vertical integration. Trump and some of his key advisors, like Vance, have been very vocal about hospital pricing opacity and about the PBMs.
Which is the exact definition of United Health. They are the ultimate middleman.
United Health owns the hospitals and the PBMs through Optum. If the government forces provider costs down or breaks up the PBM model, United Health's Optum division loses a ton of money.
But Oscar is a pure play insurer. They just pay the bills. If the government forces the bills to be lowered...
Oscar keeps more profit. Oscar's margins expand. They actually benefit from an attack on the healthcare supply chain because they don't own the supply chain. They are misaligned with the rest of the industry in a way that really benefits them under this specific administration.
But we do have to address the veto risk. What if Trump just vetoes the subsidies entirely? What if he just kills the money before this new voucher system is even ready?
And that is the macro uncertainty. A veto would cause a market contraction. There is no denying that. But remember the 28% price hike.
That's the buffer.
That is the safety buffer. Oscar essentially priced in the disaster. They built a fortress balance sheet for 2026 so that even if the political winds shift and the market shrinks, they are charging enough per remaining member to survive and potentially even stay profitable. They didn't wait for the government to come and save them.
Risk defined, portfolio protected.
That's the mantra.
Let's move to the engine room. Section 6, operational efficiency. Because you can have the best strategy in the world, the best political alignment, but if you're just burning cash on overhead, you sink anyway.
And this is where that tech-native argument actually shows up in the numbers. We talked about MLR going up the medical costs, but you have to look at SG&A.
Right. Selling, General and administrative expenses, the boring stuff.
The boring stuff that kills companies. While medical costs were soaring across the industry in 2025, Oscar managed to lower their SG&A expenses by 250 basis points in Q3.
That is a significant cut. How did they do that while they were still growing?
This goes right back to Oswell and their tech platform. Their revenue per employee is materially higher than the incumbents. Because they have Oswell doing the work of 10 junior admins, handling prior authorizations, routing claims automatically, they can grow their revenue without having to hire 10 more people. That is operating leverage. That is the model finally scaling.
And they're also launching these new, highly specialized products. I want to talk about Hello Minnow. It sounds like a greeting, but it's actually a very specific strategy.
It is a brilliant strategic move. Hello Minnow is a first-of-its-kind plan that's targeting women who are navigating menopause.
And it's targeting the 5.4 million women over the age of 45 who are in the ACA market.
Exactly. And just think about that demographic for a second. Women over 45. They are often the primary decision makers for their household's healthcare. They're generally more responsible with their health than, say, a 25-year-old male. They are sticky customers. If you offer them a plan that specifically addresses their needs, hormone therapy, specialized guidance, they are not going to churn just to save $10 a month on a different plan.
It creates loyalty, and it stabilizes your risk pool with people who are actually engaged and want to manage their health.
Precisely. And they're doing the same thing with other condition-specific plans. They've got plans for diabetes, for COPD, for asthma.
And these plans have $0 copays for critical items like insulin and inhalers.
Which sounds expensive for the insurer, right? Why would you give away free insulin? But it is actually really smart economics. If you give a diabetic free insulin, they're more likely to take it. If they take it, they stay out of the hospital. A $100 vial of insulin saves you a $50,000 amputation or a diabetic coma visit down the road.
It's investing in routine maintenance to avoid the total engine breakdown.
And because Oscar doesn't own the hospital, they really want to avoid the hospital. These plans attract the kind of members who want to proactively manage their health, which counterintuitively creates a much better risk pool than the random lottery of the general exchange.
So we've looked at the ship, we've analyzed the storm, the financial data, the politics, and the engine room. Now it's time for the verdict. Section 7, tomorrow morning, the earnings call. What is the Griffonomics call on this?
Based on everything we've analyzed, the disconnect between the death spiral narrative and the actual enrollment data, the credit card surge of plus 35%, the strategic pricing, the hiring signals, we are rating this a speculative BUY.
An aggressive contrarian call.
It is aggressive, and we have to be clear, this is not a savings bond. The volatility will be extremely high, but the market is currently pricing Oscar as if the subsidy hurricane has already sunk it. It's trading at completely distressed levels.
But the data suggests they actually navigated the storm successfully.
They retained their members, they successfully raised their prices by a huge margin, and they are entering 2026, what management themselves has flagged as their profitability year, with a massive tailwind.
So if that 28% price hike holds, and that MLR drops even just a few points because of it,
the earnings potential is massive. The stock is priced for failure. If they report even okay success tomorrow, the re-rating could be violent to the upside.
it's a classic asymmetry. The downside is limited because the market already expects death, but the upside is massive if they can prove they're still alive and kicking.
That is the trade in a nutshell.
Before we sign off, I want to leave our listeners with one final thought. We've been talking about pirate ships and galleons all day. If the Trump administration really succeeds in this vision, if they really manage to turn patients into shoppers with cash in hand, are we witnessing the end of the Spanish galleon era of insurance?
It's a profound question. For decades, health insurance has been a B2B game. Big, giant companies selling to big HR departments. The end user, the actual patient, really didn't matter all that much.
But if it becomes a B2C game, a true retail game, can those giants even pivot? Can a company with 300,000 employees and mainframe computers from the 1990s learn to be a cool, consumer-friendly app?
History would suggest probably not. It's very, very hard to turn a galleon around in a narrow harbor.
And if they can't, then the pirate ship doesn't just survive the storm. It might just end up ruling the high seas of American healthcare.
It's a brave new world for healthcare, that's for sure.
It certainly is. Make sure you tune into that earnings call tomorrow morning. Watch that MLR number. Watch the Q1 revenue guidance. And remember where you heard the thesis first.
Thanks for listening.
See you on the next Deep Dive.